nurse?
My grandma had a triple bypass surgery back in May, and she was in the intensive care unit for like 4 weeks or something. She had some complications, and I know when my family and my dad and my mom went to go visit her, a lot of the times my grandma was really sedated. She couldn't really talk, but we had to ask the nurse like what was going on, how her condition was. And a lot of times it was, oh, she's good, but like I said, the nurse also had to deal with other patients, and a lot of the times she just didn't know, she's a nurse, and a lot of times it's the doctor's decision to do stuff. So when we asked really serious questions, like deep questions, she's like, I don't know, I can't answer that yet, we don't have these results back. And I remember one time something happened to my grandma. We still don't know like what it was, but she kind of like maybe had like a miniature stroke or something, and we were really scared. And afterwards we went to the nurse and we're like, what was this? Why did this happen? And it was about 3 of them, and they were like, we don't know, like she was doing fine and then something happened and we're going to test her tomorrow, but we can't answer these questions right now. And it was just a really like frustrating thing. Not that it was their fault or anything, but there were a couple of times that they seemed really busy because there was a lot of people, a lot of patients on the hallway, and I know one person down the hall was in really, really critical condition. They were really concerned about that person. So a lot of times it was in and out just to check, but they really couldn't like answer a lot of questions because they were really flustered. I have no idea. I don't know, when I think of a nurse, I can't really put it into one word, but think of I know a lot of people who are nurses are moms, and they're really knowledgeable in what they do, but they also help, they help their patients, but they'll help their friends and their family, and they really, really care. So maybe, generally, compassion is what I say. Most of the nurses I know are really, really compassionate, and they really do care about their patients, and they really care about make sure you know your material, and you don't get really, really flustered if someone asks you a lot of questions, because yeah, it may be annoying that someone's asking a lot of questions, but then again, this is like the life of someone who's really, really loved by those people. So it's like, try to just keep everything in and don't vent out or get frustrated with a patient or the family of the patient, because they really just care.